Okay, the next two, I did rhyme. Rubeola, Ebola. I did good there. Now, rubeola is another name for what? Old school measles. Let this be your guide on this exam. I underlined it in black. Here's a little purple to go with it. Old school measles. Rubeola. Old school measles. Those are the only two names. OMG. Old school measles. You better know Koplik spots. Koplik spots are with the K. Koplik. K-O-P-L-I-K. Koplik spots with the K. Two Ks actually. Koplik spots are these bluish white bumps on the buccal mucosa, and the buccal mucosa itself will be red. So we tell you to remember red, white, and blue. Bluish white spots on the buccal mucosa, so inside the mouth. Very early sign. The other early sign is the rash on the face. Rubeola, school measles, also has a rash on the face. So the rash on the face and the Koplik spots on the buccal mucosa, this is what makes up this disease. The rash is going to spread all over the place, but it starts on the face. Good thing to remember is all childhood diseases, the rash starts on the face except for chickenpox. Rubeola, school measles. Okay, self-limiting, there's no treatment. It's going to be okay. Now, we had a measles outbreak over there in Disneyland. It came all the way across the land, okay? Bad fever and rash. And then, of course, Ebola. There are two types of Ebola. It's very confusing. Life was good in the hood till we had Ebola come over here, because it was one simple way to teach it for the 15 or 16, 17 years that I've been doing this. It was just one way to teach it. It's a bioterroristic attack, keep it moving. No, now you're going to be very confused, because it's actually two different ways you could see Ebola. One is the natural occurring state. Obviously it's diarrhea, so it's contact and enteric precautions. Private room. All diarrhea goes in a private room. This is what killed so many, oh my God, so many people. And of course, we had our own exposure to it here at Emory and different hospitals throughout the nation, and many nurses, and it had to do a lot with how they took off their PPE and how they put it back on. So that was important. We're going to go through that. Okay, and then the other presentation of Ebola is going to be if it was a bioterroristic agent, it was manipulated in the lab to become a bioterroristic agent. And the way they would kill us, or try to anyway, is they would put it through subway stations and different areas where huge amounts of people would be exposed. So if you put it through the subway, if you infuse it through the subway station, like New York, you know, you're going to get everybody. Now, what can we do to protect ourselves with this? Well, oh goodness, you would have to protect all mucous membranes. So here is where the goggles come in. Here is where the face shield and the mask, surgical mask. Remember, the face shield is the plastic shield to go up. So you got the mask and the face shield with it on the mask, on top of the mask, right? It's part of the mask. You'd have to make sure as a nurse you didn't prick the skin. Because once you prick the skin, you gave an entry for the Ebola. So you'd have to minimize IMs, venipunctures, IVs. If it's a pill or a drink, you could do it, but you don't want to be puncturing the skin because that's a route of entry for Ebola. Remember how we know this is a bioterroristic attack. Remember this. Because, you know, you got this one up here, smallpox, same thing, bioterrorism. The way I would know, the way you're going to know, and it is truly going to be you, because you are the first person to see the patient. It's going to be a cluster of the same zip codes. And a cluster of people from the same area or having went to the same event, like a Beyonce concert, hello. These people are all going to come in with the same complaints. So everybody either did the same thing or they came from the same place. Cluster of people, same complaints. Either went to the same place, like the concert or whatever, the ball dropping in New York, whatever. Okay, cluster of people. Now, chickenpox is up here. What is the other name for chickenpox? Varicella zoster. And I need you to remember that chickenpox, shingles, and herpes are all herpetic lesions. So they all are like vesicles initially. Okay, so with chickenpox, you are going to see vesicles. Our problem with chickenpox, which is why it's airborne, is it's contagious 3 days before you see that. You know, with this condition, you've been taught in school, I'm assuming, incubation period. Now, I got to put it all up in your backyard and down your parking lot in a way that you didn't learn it. Because you can't relate. Some of you are so young you can't even relate. But number one, I authorized my daughter, who's now 32, to be used in the research to test the Varicella vaccine. This is why most of you will never know this story. That's number one. Number two, history. What was history? History, and some of your families did the same thing. History of chickenpox was that back in the day, you did not have 1.8 children. You usually had 3, 4, 6, 8 kids, and the thought of each one of them sprinkling chickenpox over the next 5 years was too much to bear. Because if you were a working mom, which a lot of people were, most weren't, but if you were a working mom, you was going to be taking off all that time because your kid couldn't go nowhere else. They had to stay at home. So you wanted to get this shit done. What did we do? Awful parents we were. We all took our kids over to the chickenpox house. How many people know about that? Oh, look at you, a lot of hands, good. So we took, oh, you too, Lou? Cameraman said he know. Okay, so everybody took their kids over to the chickenpox house, usually your cousin. And everybody got it at the same time, because here's what we prayed on. You better write down that the incubation for chickenpox is 14 to 21 days. 14 to 21 days. Now, of course, incubation means from the time you expose the kid, and let's make our math simple because I failed math. Let's say January 1st. So January 1st, you went over to cousins in them house, and they all was exposed to the cousins with the measles. The mother or father or both expected for this kid to have chickenpox lesions 14 to 21 days later. So you planned your life around that. 14 to 21 days is the incubation period. From the time of exposure to the time of clinical symptoms. Definition. From the time of exposure to the time of clinical symptoms. Cousins in them house, January 1st. Vesicles on the skin, January 14th to 21st. So 14 to 21 days, boom, incubation period. Now, of course, y'all are bougie. Y'all don't take your kids nowhere. They don't even go outside the house. They play PlayStation, all the shit. Because y'all got vaccinated. Thanks to my daughter, most of you have been vaccinated. The vaccine is extremely effective. I was pleasantly surprised at how effective it was. Delighted that the older sister set the path for the younger one. And these kids nowadays, they just don't get it. But everyone got it back then. It was accepted. Now, it was horrible, not because of the chickenpox infection. Oh, no, 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 no. When you have a childhood infection, what did I say all childhood infections have that go with it? A high fever. What do you know about children with high fevers? Seizures, excellent. So if you are the parent with the kid with the high fever and you scared because your neighbor's child seized when they had their high fever with their chickenpox, you trying to get his baby something so they don't have a high fever. The problem was, you can't imagine, wasn't no Tylenol back then. Wasn't no Motrin back then. Wasn't nothing but Bear aspirin or St. Joe's aspirin. If you ask me, they both taste like Smarty candies. That shit was good as hell. How many people overdose on orange? Thank you. Thank you. I got company in the room. Okay, good, good. It's good to know you're normal. Okay, so the shit tastes like candy. It's little orange candies. And that's all you had to give your kid for this high fever. What did that do for so many children? Reye's syndrome. You cannot give aspirin to a viral infection in children. It will cause Reye's syndrome, which is a neurological condition that kids died from. Giving you a little hookup on your pediatrics just then. Reye's syndrome, neurological infection, condition. Sort of like meningitis, but not quite. Okay, all right, so you got this now. You got it, you understand. Okay, now the last entry I have here for the airborne condition, I have here RSV with the little bitty g. RSV with the little bitty g attached to it. The reason why I have that there is because RSV technically is not airborne. It's not airborne until you treat it with ribavirin, and at this point, now you created an aerosol. You took what was contact and respiratory, and you sprayed it all over the room with an aerosol treatment. Now the little G means goggles. As I told you earlier, you have a little handout that has goggles on it. And it talks about the goggles. You don't have to bring it out, but I told you about this. Now, so if I'm treating the RSV baby with an aerosol treatment of ribavirin, I'm going to have to use goggles. Who cannot take care of RSV children? And why? It's not a teratogen. But what is? Ribavirin. Ribavirin is the teratogen. RSV is not the teratogen. Be careful with that. Ribavirin is the teratogen. So pregnant nurses don't need to be nowhere in this cohort of kids.